a child that seems as if they are being driven by a motor, cannot seem to follow directions, and constantly argue with authority. These children often get labeled as troublemakers and bad kids. However, they may actually suffer from ADD. Today I want to discuss ADD and ADHD, genetics as a risk factor, and treatment. ADD was first recognized as a disorder in 1902. A British doctor, Dr. Still, named it defect of moral control. In the last 111 years, since the first reported case made by Dr. Still, there have been many studies on the causes and course of treatment. ADD, or ADHD, is one of the most commonly diagnosed childhood behavioral diseases to date. According to the Center for Disease Control, CDC, as of 2007, report that approximately 9.5% of children ages 4 through 17, 5.4 million, have been diagnosed with ADD or ADHD. Children who suffer from ADD usually start to exhibit signs at an early age. While most children exhibit some of the typical ADD or ADHD behaviors at some point during their childhood, the ADD child exhibits these behaviors on a daily basis. Most parents ask themselves, what am I doing wrong? ADD children often exhibit forgetfulness, spontaneous actions, trouble concentrating, daydreaming, and hyperactivity. Impulse control is one of the most commonly reported symptoms of ADD and ADHD. According to the NIH News, children with ADD have trouble paying attention and controlling impulse behaviors, and may be overly active and often result in poor school performance and social difficulties. There are also increased risks for substance abuse disorders, particularly if the symptoms go untreated. According to the Attention Deficit Disorder Association, in order to meet diagnostic criteria, these behaviors must be excessive, long-term, and pervasive. A crucial consideration is that the behaviors must create a real handicap in at least 2 areas of the person's life, such as school, home, work, and social settings. These criteria set ADHD and ADD apart from normal distractibility and impulse behavior of childhood. There are many factors that play a role in a child developing ADD or ADHD. Is there a genetic connection with ADD or ADHD? According to WebMD, studies have shown certain genetic characteristics that occur with high frequency in families where one or more family member has ADD or ADHD. Also, if one or both of the parents have ADD or ADHD, their children are more likely to develop the condition. And at least 1/3 of all fathers or mothers who had ADD or ADHD in their youth have children with ADD or ADHD. Let me use my family as an example of this. I suffered from ADD as a child, and 3 out of my 4 children have been diagnosed with ADHD. My 10-year-old son is a perfect example of ADHD and genetics. My son was diagnosed at the age of 6. His diagnosis came after many meetings with the school principal about his disruptive behaviors. My son's father was diagnosed with ADHD as a child, and as I stated earlier, I was diagnosed with ADD. My son was started on Ritalin and behavioral modification therapy. Within 2 weeks, we saw immediate improvement in his behavior and academics. An individual who suffers from ADD and ADHD has dopamine levels that are lower than the average individual. Dopamine is a neurotransmitter that helps control the reward and pleasure center of the brain. According to Jane Collingwood, author of The Genetics of ADHD, A 2009 review concluded that genetics account for 70 to 80% of risk. Specific genes have produced good evidence linking genes to this disorder, particularly dopamine D4 and dopamine D5 genes. There are also other reasons that are believed to contribute to ADD and ADHD. According to WebMD, the presence of certain toxins in the environment, such as lead, PCBs, or pesticides, may have a role in causing ADD and ADHD. Researchers believe that some toxins may interfere with the brain development of children. That, they said, could possibly lead to ADD or ADHD. Babies with low birth weight are at a higher risk of developing ADD. Lastly, women that smoke and drink and use drugs during their pregnancies have a higher risk of having a child that will develop ADD or ADHD. Treatment for ADD and ADHD has come a long way in the last 30 years. Treatment for ADD and ADHD may consist of the use of stimulant medications such as Ritalin and non-stimulant medications such as Intuniv. Since ADD is a behavioral disorder, it is recommended that behavioral modification therapy is used in conjunction with medication. Children with ADD and ADHD thrive from consistency and routines. The reward system is a technique that behavioral modification therapists use with ADD children and ADHD children. According to the Mayo Clinic, children with ADHD often benefit from behavioral therapy and counseling, which may be provided by a psychiatrist, a psychologist, a social worker, or any other mental health professional. Some children with ADD or ADHD may also have other conditions such as anxiety and depression. In these cases, counseling may help both the ADHD and the coexisting problem. The best approach to the treatment of ADD and ADHD is to build a network of the child's parents, teachers, doctors, and therapists. Children with ADD and ADHD thrive from these individuals working closely together towards the same goal for the child. When dealing with children that are hyperactive and unruly, it might not be entirely their fault. There are many factors that can play a part in a child developing ADD or ADHD: genetics, environment, parenting skills, and mother's habits during pregnancy. No matter what the risk factors are that play the part in the child developing ADD or ADHD, treatment and consistency is the final factor in determining if the child will live a fairly normal life.